A very common spice used around the world, cinnamon. Can cinnamon have powerful effects on our health? Tune in to find out only here on the People Scientist podcast. You are listening to the People Scientist, the podcast dedicated to helping us optimize our health with the latest scientific findings on neuroscience, physiology, and nutrition. I, your host, Dr. Stephanie Caligiuri, a nutritionist, physiologist, and neuroscientist, will be here with you every single week, bringing us information to ignite our thinking, to help us be one step closer to the healthiest we can be. Hello, my People Scientist Army, and welcome back to the People Scientist podcast for episode 76, where every week I arm us with some scientific evidence so we can all lead the healthy lives we want to live. Happy October, everyone. How are all of you? Fall or autumn is upon us, so I decided to do some topics about October themes this month. In the fall, many foods, flavors, and beverages are more popular. And of course, we also have Halloween. So I will be doing some on-theme topics this month. So for today's episode, I'm sharing some scientific evidence on the health effects of a very common spice that is increasingly used during the fall, and that is cinnamon. Are there any health benefits to cinnamon? Let's find out and jump into those core takeaways. Cinnamon is a very common spice that is used across the world. Clinical trials have been conducted looking at typically doses ranging from 1 to 6 grams of cinnamon per day. The most clinical evidence available supports the potential benefit of cinnamon in reducing blood sugar levels and improving health parameters in type 2 diabetes. So cinnamon may have benefit against the risk for type 2 diabetes or to help manage type 2 diabetes. Cinnamon may exert these benefits by reducing the rate at which food moves in the intestines, by reducing hunger signals in the brain, by increasing glucose uptake by our muscle and fat tissue from our blood, by increasing energy production by the mitochondria, and potentially by exerting antioxidant effects. Now, let's get into those details. Cinnamon is a very common spice that is consumed around the world, and there seems to be two main species of cinnamon, Cinnamomum zalancium and Cinnamomum cassia, and both seem to be studied clinically. The majority of the clinical data I found was in regard to cinnamon intake in patients with type 2 diabetes. For example, in 2019 in the journal Diabetes Research and Clinical Practice, scientists pulled together 16 randomized controlled clinical trials that included participants with type 2 diabetes or pre-diabetes. The scientists aimed to determine if regular cinnamon intake could improve markers of diabetes. Across these 16 different clinical trials, different amounts of cinnamon were tested, as low as 1 gram per day, up to 14.4 grams per day. They concluded that regular cinnamon intake reduced fasting blood glucose levels and improved insulin sensitivity. Santos and De Silva in 2018 nicely reviewed how 1 to 6 grams of powdered cinnamon taken per day may have benefit for improving measures of blood sugar and insulin sensitivity. For example, they saw improvements in fasting blood glucose levels ranging from 12.9 to 52 milligrams per deciliter, which is quite profound, and improvements in HbA1c, that gold standard for blood sugar long-term levels, improved anywhere from 0.27 to 0.83 points. So the scientists concluded that cinnamon intake may be combined with other strategies to help individuals with blood glucose control. For example, other strategies such as reducing carbohydrate intake, exercising, eating high fiber, cinnamon could also be another strategy in combination with these healthy lifestyle strategies to help with the management of blood sugar levels. So let's dive into the details of one of the clinical trials included in these meta-analyses and reviews. In 2003, in the journal Diabetes Care, scientists recruited 60 men and women living with type 2 diabetes. Participants were given either 1 gram, 3 grams, or 6 grams of cinnamon in capsules to take daily for 40 days. There was also a placebo group that took capsules with no cinnamon. After 40 days, fasting blood glucose levels reduced in the cinnamon group by on average 18 to 29%, which is a really great improvement. For example, at baseline, the participants' average blood glucose reading at fasting was 11.6 millimoles per liter. After 40 days of cinnamon intake, their fasting blood glucose dropped to on average 8.7 millimoles per liter, which is really great. Some benefit was already seen at the halfway point at 20 days, but the benefits continued to occur on their fasting blood glucose levels and were even more prominent at day 40. The participants also saw some improvements in their fasting triglycerides, which are circulating fats in the blood. They dropped by 23 to 30%. And LDL cholesterol, which has the potential to become oxidized and increase the risk for clogged arteries, improved on average by 7 to 27% with cinnamon intake. Interestingly, when looking at the different doses of cinnamon, 1 gram, 3 grams, or 6 grams, the lowest dose of cinnamon at 1 gram per day seemed to induce the greatest benefit on these measures of blood glucose and fasting triglycerides and cholesterol. The scientists did not report any serious side effects with intake of cinnamon at these doses. So that was a landmark clinical trial, one of the first, to show that cinnamon may have some very, very beneficial effects in those patients living with type 2 diabetes. So how about we go through another well-designed clinical trial? This study was just published in the journal Clinical Nutrition last year by Zaire and colleagues. The scientists recruited 140 participants living with type 2 diabetes in a triple-blind, multi-center, randomized, placebo-controlled clinical trial. Half the participants took 500 milligrams of cinnamon twice a day, so 1 gram total per day for 3 months. The other half of the study participants took a placebo. After 3 months of consuming cinnamon, many benefits were seen. For example, those taking cinnamon saw a reduction in the fat around their organs, otherwise called visceral fat, by 0.7%. Their fasting blood glucose dropped by 19 milligrams per deciliter on average. Their HbA1c, that long-term measurement of blood glucose, dropped on average by 0.42 to 0.93 points. Their triglycerides fell by 19 milligrams per deciliter. And improvements were also seen for their insulin sensitivity and blood cholesterol levels. These improvements are pretty profound and are thought to impart some benefit and to reduce the risk for long-term health complications. The scientists noted that if the participants had a body mass index greater than 27, then they were more likely to see a benefit. Now, this is a very important clinical trial that I think contributes greatly to the notion that cinnamon may have some great benefits for individuals living with type 2 diabetes. How about in individuals without diabetes that have blood glucose levels that are within the normal range? Does cinnamon have an impact on their blood glucose? Well, the clinical data suggests yes, this is possible. In the American Journal of Clinical Nutrition in 2007, 14 subjects without diabetes were recruited to eat rice pudding alone or rice pudding with 6 grams of cinnamon added to it. Their blood glucose levels were measured before and after. The addition of cinnamon significantly reduced their blood glucose response to the rice pudding. But the scientists took it one step further and wanted to understand how this could be the case. The scientists hypothesized that cinnamon may reduce gastric emptying rate, meaning the rate at which the food moves from the stomach into the intestines. Now, this could potentially result in lower blood glucose levels, because if the rate at which glucose is produced and absorbed into the blood could be slowed down, then it could prevent blood sugar spikes. And it turns out that yes, the scientists' hypothesis was correct. the addition of cinnamon to the rice pudding had slowed the gastric emptying by 2.5 points. So that could be one of the potential mechanisms by which cinnamon may reduce blood sugar levels. So besides potentially slowing the rate at which the stomach empties, how else might cinnamon may be having an impact on our blood sugar levels? Well, this topic was reviewed very nicely in the journal Pharmacological Research by Zhu and colleagues in 2017. It is thought that the active ingredient in cinnamon may be cinnamaldehyde. In preclinical studies, cinnamaldehyde appears to increase the expression of glucose transporters in the body in order to take glucose from the blood and bring it to our organs to be used up for energy. A good analogy would be to say that cinnamon is like the store manager that calls up the extra cashiers at a grocery store so that customers can get through the checkout quicker, so that the customers can get home to eat their food more quickly. Likewise, cinnamon may make some changes to get the glucose through more quickly. Again, in preclinical models, cinnamon also appears to increase energy production by the mitochondria in our muscle cells. This is called mitochondrial biogenesis. It is thought that cinnamon may also impact the satiety signals in the brain that tell us when we are satisfied and when to stop eating, as some preclinical studies show that cinnamon intake increased the expression of POMC, cholecystokinin, and BDNF in the hypothalamus of the brain. Another potential mechanism is that a lot of spices and vegetables tend to have a good amount of antioxidant activity, which is important because they may exert some benefit against oxidative stress. Oxidative stress has been implicated in so many chronic diseases such as heart disease and cancer. So reducing oxidative stress is considered beneficial in the majority of scenarios. Dragland in 2003 found very high concentrations of antioxidants, greater than 75 millimole per 100 grams, in cinnamon. The authors speculate that several of the effects of cinnamon could be mediated by its antioxidant activities as well. There are other effects of cinnamon that have been seen in preclinical models, but these mechanisms I just mentioned, in my opinion, were the best supported by the scientific evidence. Is there clinical evidence to support cinnamon having other health effects? Well, in the journal Clinical Lipidology in 2017, scientists looked at 13 clinical trials to determine if eating cinnamon every day could have an impact on blood lipids like blood cholesterol and triglycerides. Now, these are seen as risk factors for heart attack and stroke. The scientists concluded that regular intake of cinnamon may improve fasting triglycerides. Now, triglycerides are often elevated with chronic alcohol consumption and with fatty liver disease. High circulating triglycerides in our blood may put us at risk for heart disease. So the fact that cinnamon may help lower fasting triglyceride levels is seen as a beneficial effect. And cinnamon also seemed to improve total cholesterol levels, but did not overall seem to significantly impact LDL or HDL. And these conclusions were based on looking at those 13 clinical trials together. So if cinnamon may have some potential benefits to blood glucose levels and perhaps triglyceride levels, is consuming cinnamon safe? Overall, yes, cinnamon is seen to be safe to consume. However, it is important to keep in mind that too much of anything can potentially be bad, so please always do keep this in mind. Many safety studies have been conducted in rats to see if long-term intake of high amounts of cinnamon or cinnamaldehyde had any toxic effects. And long-term, they did not see any major adverse effects unless the amount consumed was well beyond the level that any human would consume. Scientists do caution, though, against cinnamon being used on the skin and also caution against it being inhaled. For example, some people may use cinnamon-scented oil and put it on their skin as a perfume, but they caution against this as it can cause skin sensitization, redness, and burning of the skin. As well, some vapes or e-cigarettes may include cinnamon flavorants, and there is some evidence that this can damage the cells of the respiratory tract. So please do keep that in mind. I would say that the grand majority of the clinical trials have looked at 1 to 6 grams of cinnamon intake per day, And I would say that because 1 gram seemed to be effective in several clinical trials, at the lowest possible effective dose is best to go with. The higher the dose we go, the more likely we may experience side effects with anything. So 1 gram is actually not that much. 1 tablespoon of cinnamon is nearly 8 grams. So 1 gram would be less than half a teaspoon of cinnamon per day. And for example, every morning I make myself a black coffee, and for flavor, I like to add a little bit of cinnamon on top. And I probably add about 1/3 of a teaspoon. So that may be all we have to do in order to see potential benefit, is to add 1/3 to half of a teaspoon to our beverage or to our foods. One important thing that I do want to point out is that often lifestyle or nutrition interventions like this have to be combined with other healthful measures like exercise, eating plenty of vegetables, healthy fats, fiber and protein, and drinking plenty of water. Having that strong foundation is so essential. And then adding small other things to that foundation has potentially more benefit. For example, I understand that many of us already practice these healthy habits of exercising and eating a balanced meal, but we may still struggle to obtain normal blood glucose levels. And that is where I hope some of these small measures can be of assistance. For example, I did an episode on the clinical evidence of apple cider vinegar for blood sugar levels and type 2 diabetes in episode 8. So perhaps adding 1/3 a teaspoon of cinnamon and 1 to 3 tablespoons of apple cider vinegar in warm water could be a helpful strategy for some to help maintain proper blood glucose levels. But please always do seek the advice of your physician or dietitian who knows your specific medical history. So that is a wrap, my People Scientist Army, for the first episode of our October-themed topics: cinnamon spice and everything nice. Cinnamon is a spice that may exert some benefits on our health by lowering blood glucose levels. It may lower our blood glucose by delaying gastric emptying, by increasing glucose transporters in our cells. So remember, by being the store manager, that's increasing the number of cashiers that are out there, making sure that we're getting through the line faster. Cinnamon may be able to increase the transporters that are bringing in the glucose so that we can use it for energy, as opposed to having it staying in our blood circulating around. Cinnamon may also be exerting some of these benefits because it seems to be quite rich in antioxidants and has a good antioxidant capacity. And the amount of cinnamon that we may need may be as small as 1/3 of a teaspoon every day. I hope that this information was useful and interesting for all of you. I know I found it to be really intriguing. Make sure to follow me on social media, where I share the papers I cite in my episodes and where I share extra tidbits of information on the week's topic. If you want to buy me a coffee to say thank you for the episode, you can find my Patreon link and Venmo ID in the description box to this episode. And I thank you so much in advance for that. So thank you for hanging out with me on another episode of the People Scientist podcast. I look forward to meeting you back here the same time and same place next week for some more October fall-themed episodes. I hope you have an awesome and healthy week. Bye for now. I am a scientist simply sharing scientific evidence. Some of the clinical interventions I discuss are not appropriate for everyone. Before making any changes to your diet or lifestyle, please do consult the advice of your physician or dietitian. My opinions expressed here do not necessarily reflect those of Mount Sinai Hospital and its affiliates.